After Hurricane Maria swept through Puerto Rico in 2017, the island was left shattered. Power grids were in ruins, hospitals struggled to meet the demand, and access to necessities like food, clean water, and shelter became scarce. For many, survival depended on luck. For others, luck ran out. Juana Castro Rivera was a 52-year-old mother, daughter, and friend. In the days after the hurricane, she began feeling sick, weak, feverish, in pain. She visited her local clinic more than once in search of help. However, the overworked staff missed the signs that might not have been missed if there had been more doctors. With the exodus of doctors in recent years, the clinics were left understaffed and overwhelmed during the crisis. Juana had leptospirosis, a deadly bacterial infection that spreads through contaminated water, the water she had no choice but to drink. The island's medical system, which was already fragile before the storm, couldn't diagnose her in time because of the load it was carrying at the moment.
¿Y desde cuándo te sientes así?
Par de semanas.
¿Y por qué no viniste antes?
Es que no encuentro cita.
Vamos. Juana tenía una infección y por falta de personal no pudimos atenderla correctamente. Esto pasa muy frecuente y tiene que parar.
It was too late when she reached the hospital with the right equipment and tests. Juana's story is not unique. It is one of many. Doctors are leaving Puerto Rico and it's hurting the people who stay behind. Why are doctors leaving Puerto Rico? How is it hurting the people who stay behind? And what can be done before more lives like Juana's are lost? Ever since the late 20th century and early 21st century, Puerto Rico has been going through a severe healthcare crisis due to the mass migration of doctors leaving the island. Over the past 3 decades, thousands of doctors have left, creating a growing shortage that puts both public and private healthcare systems at risk. Many physicians leave because of low salaries, high operating costs, and difficulties working with Puerto Rico's healthcare system. The exodus of Puerto Rican doctors will ultimately affect the island's people by limiting the number of options when it comes to treatment and availability. One of the most critical problems in Puerto Rico's health industry is the shortage of doctors. Puerto Rico has lost nearly half its doctors since 2009, pediatricians declining from 700 to 500. In actuality, there's a minimal number of orthopedic surgeons and other medical specialists, including endocrinologists, rheumatologists, otolaryngologists, and psychiatrists. The loss of these specialists has worsened the healthcare issues, leading to increased stress and burnout for those who continue to practice in Puerto Rico during high demand. Worsening healthcare needs amid high tuition and limited educational access are leading many graduates to leave for better jobs. Between 2011 and 2017, Puerto Rico trained 111 family medicine residents, but only 45% remained, resulting in a retention rate of 40.5%, the lowest in the nation. Low retention rates can cause a problem in the continuity of care, which can lead to an increased workload for those doctors who stay in Puerto Rico.
La reforma en realidad funciona como, ¿verdad?, cualquier plan privado, más que al médico, porque todos los planes, incluyendo los privados y la reforma, son igual de malos. Afecta más al paciente. Con la reforma hay que pedir referidos, a veces pues el médico, la cita está lejos, el referido se va a tardar, el referido se vence, tienes que volver para un estudio, tienes que pedir el referido, más tienes que ver que te lo acepte. Y en ese aspecto la reforma es un poquito más chabona con rechazar las cosas, los estudios y todas esas cosas. Al médico lo afectan en que se tardan en pagar, que hay que trabajar mucho papeleo.
Several causes can be attributed to the shortage of doctors in Puerto Rico. In 1993, La Reforma privatized the public health system, selling off government hospitals and instead shifting care to private insurers. While it aimed to cut costs, it led to reduced services, a dominance of insurers, and corruption. Doctors faced lower pay, limited say, and many obstacles that promoted many of them to leave the island behind. Another obstacle is the island's national debt. In 2017, the largest municipal bankruptcy in U.S. history was filed. Puerto Rico declared bankruptcy and couldn't pay its $70 billion public debt. This came to be a result of decades of mismanagement of funds and excessive borrowing, crippling healthcare investment. The problem in Puerto Rico's hospitals is often cited as the lack of sufficient funding and resources. Years of budget cuts have drained the system, leaving many hospitals short on staff, stuck with outdated equipment, and some are barely able to maintain their buildings. For doctors, that meant working in under-resourced environments, such as inaccessible medical supplies, equipment, and medications to treat their patients. Many were expected to do more with less, all while struggling with their salaries, as in 2023, insurers were fined $300 million for underpaying doctors. Insurance approvals are a whole other battle. A lot of patients end up getting misdiagnosed or their treatment gets delayed because doctors are stuck waiting on insurance companies to approve their next step.
In addition, Puerto Rico receives significantly less Medicaid funding than any other state. Medical funds in Puerto Rico are insufficient, covering only 15 to 20% of costs, leaving Medicaid patients unable to find affordable doctors. For example, the 2019 block grant was $367 million, but the total costs were $2.8 billion. In addition, Puerto Rico receives only $5,119 per capita in federal health care, significantly less than the national average of $14,170, while over 40% of residents live below the poverty line. The disparity in support of healthcare is responsible for $25 billion of the debt. Due to this, doctors endure delayed payments and claim rejections by insurance companies, driving many to seek stability elsewhere.
To make matters worse, the island has also gone through many deadly natural disasters, such as the devastating Hurricane Maria in 2017, as well as a historic 6.4 magnitude earthquake that struck the island during the COVID-19 pandemic in 2020, which left many structures unsafe for the general public of Puerto Rico and caused even more stress in the system, which was already dealing with a global pandemic. The shortage of doctors in Puerto Rico seriously affects the island's healthcare system and the patients who rely on it. One of the biggest problems is the long waits for regular medical appointments. Many people are forced to wait months to schedule an appointment with a doctor. Some waits can stretch on for 6 to 9 months. These delays happening regularly can mean life or death for many with chronic and deadly health conditions. When a crisis hits, like the frequent power outages the island goes through, or hurricanes, it can be especially dangerous. Public hospitals and emergency rooms are overwhelmed. With not enough doctors on staff, especially in emergency rooms, medical centers struggle to keep up with the demand, especially when down in personnel. Patients with serious conditions may wait too long, and overcrowding can make it harder for healthcare workers to do their jobs efficiently. Specialist care is even harder to access. Puerto Rico has only 15 cardiovascular and thoracic surgeons, most located in the metro area, like San Juan and Bayamón, making it harder for people in rural areas to get care. Some fields are nearly empty. Only 3 vascular surgeons have returned to the trauma center in the past decade, for a population that needs at least 36 of them to accommodate the needs of all who need them. The gap is alarming. Puerto Rico's healthcare system is in crisis, but that doesn't mean it's beyond repair. Here are some key solutions that can make a real difference. First, there needs to be an investment in the system itself. This means offering economic incentives to keep doctors and professionals on the island. For doctors to stay, their working conditions need to improve. Businesses also play a huge role. Encouraging local and outside investments is essential for rebuilding and strengthening our healthcare economy. Some health experts like Heriberto Marín Centeno, a professor at the Graduate School of Public Health at the University of Puerto Rico, advocate that a national insurance system could help professionals negotiate better rates, giving them the support they need to provide quality care. There also needs to be an increase in the federal block grant as it matches the real cost of running our healthcare system. Expanding Medicaid eligibility is insanely critical, too, as it would help cover more low-income patients who need care the most. Puerto Rico should receive the same level of healthcare funding as any U.S. state. Anything less is unfair. Funding needs to be long-term and stable. Without that, nothing suitable can be built.
Lo principal, en mi opinión, que debería hacer el gobierno es fiscalizar los planes médicos, porque ellos son los dueños y señores de la salud de Puerto Rico. Todos, los privados más que la reforma, diría yo. Te regulan todo, ellos establecen tratamientos, establecen procedimientos, ellos son los que dicen si se hace, no se hace, qué se da, no se da. Y el médico se cansa de tener que bregar con eso, más tener que bregar con todo lo demás, que así ayudan a retener los médicos y también mejoras la calidad del sistema de salud y ayudas más a los pacientes.
Changing the environment in which healthcare workers are operating is very needed. By investing in training programs and offering real incentives like competitive salaries, benefits, and even loan forgiveness to convince incoming medical students to stay and serve their communities. Since natural disasters are a constant threat on the island, the government needs better disaster response plans and stronger hospital infrastructure. Lives depend on it. Working here also needs to be more appealing. That means better pay, better benefits, and better resources. Doctors shouldn't be burned out or working without the tools they need. They should feel supported and empowered. Puerto Rico deserves a healthcare system that works for everyone, and that can be done as long as there is a will to work for it. In essence, the mass migration of doctors from Puerto Rico is a growing crisis that is a danger to the island's healthcare system and puts patients at risk. While financial struggles, a lack of resources, and low salaries push many doctors to leave, cultural aspects and family keep some from migrating. Puerto Rico has to act quickly to prevent any more damage by raising funding, offering better salaries, and making structural changes to its healthcare system. Without real solutions, the island will continue to lose its doctors, which will worsen an already weak system and make quality healthcare even harder to access for Puerto Ricans.